Well, we told you yesterday the woman who was charged with manslaughter in the death of a 7-month-old girl made her first court appearance. Dixie Villa was babysitting the girl and her brother in February. The next morning, Villa told police she noticed the girl's skin was discolored. The autopsy report reveals the child died from an overdose of Benadryl. Now, the doctor wrote in the report, Benadryl should not be given to children under 6 years old to make them sleep. Now, joining us with more details about over-the-counter medication for infants and its dangers as well as benefits is Dr. Paul J. Aiken, Division Chief of Pediatric Emergency Medicine from the University of Hawaii Department of Pediatrics. Good morning, doctor.
Good morning.
Okay, so tell us about this. Are there big dangers with giving keiki over-the-counter medications such as Benadryl or other cold medications?
Sure. I think parents need to be aware that any medication, even over the counter, although not prescription medications, do carry risks, especially when given to younger children, under the age of 2. Something as simple as even acetaminophen or Tylenol, if it's given in excess, can have toxic effects.
And why is that? Why is it when it's the younger age?
In general, children younger than the age of 2 are just more sensitive to this. They can have more adverse reactions to these types of medications.
Okay, and have there been cases of pediatric deaths due to anything that was topical on the skin?
Sure, so there's been multiple cases of toxic effects from like Benadryl ointment or creams or salicylate creams such as Bengay. When these creams or gels are applied to children's skin, especially infants, they can absorb them much more rapidly, especially if they have skin conditions such as eczema or they've taken a hot bath. Their skin's going to absorb it more quickly, and it can lead to toxic effects. And unfortunately, there has been at least one case report of a 13-month-old who died from a Benadryl ointment applied to the skin, and it resulted in an overdose.
Oh, so tragic. All right, so for parents that, are looking into potentially giving their keiki over-the-counter medications, because, when it comes to parents giving them medications, it's typically, to help them, definitely not to harm them. So what would you suggest to parents looking into that?
It's a good question. I think anytime you're going to give your children any over-the-counter medicines, you need to realize that there are risks involved. You need to follow the dosing instructions very carefully, especially under the ages of 2. In general, over-the-counter cold medications aren't even recommended under the ages of between 4 and 6 because there's been many adverse reactions and the benefits are actually not that great. So I think if you're going to give the medicines, follow the instructions very carefully. Definitely consult with your pediatrician or consult with poison control.
Okay, so when you say that they're not typically recommended for those ages, is it better to just kind of let the children, go through the normal cold process without giving them anything?
That's right. I mean, definitely you can give fever medication is fine if under the proper dosage, but healthy children can fight through a cold or an allergy on their own with their immune systems.
All right, and might as well do it the natural way, right?
Correct.
Instead of risk something that could potentially be very tragic. Do you have any other suggestions that you would like to add?
I think in general, consult with your pediatrician.
Yeah.
I think that's going to be the expert in the care of the children.
Okay, wonderful. Well, thank you so much, Doctor, for joining us and giving us these tips. Again, it's never worth the risk, so make sure you're always talking to your doctor and knowing what's best for your keiki, because we want what's best for them, right? And we always try to give them the best, but we don't have PhDs, we don't know what we're talking about a lot of the time, so you might as well talk to the professionals that do to keep your keiki safe. All right, well, thank you so much again for joining us.